Well, that has become one of the leading causes of death in people between 18 and 55. More people are dying from overdose deaths in Oklahoma than are being killed in motor vehicle accidents. The most recent data, 2012, is over 800 overdose deaths in the state, and about 80% of those are due to prescription drugs. 55% of the people who die of overdoses in the state are using 2 or more controlled substances at the same time, or using those drugs in combination with alcohol. I think this is one of the major public health issues of our time. The number of overdose deaths in Oklahoma have tripled in the last 12 years, and it's increased every year. More than that, the CDC tells us that 8% of the population of this state are abusing prescription narcotics. That's over 300,000 people that currently are abusing prescription drugs. So we have people not only dying from the use of narcotics, but lives are being devastated by the disease of addiction. Yet we want to deal with this as a criminal justice problem, whereas it needs to be addressed as a public health problem, because that's really what it is. And if we're going to make any inroads on the problem, we have to address prevention and treatment, as well as trying to control the access to these drugs. I think it's mostly people who are addicted. And what happens is that people who are predisposed to becoming addicted have access to the drugs through legitimate prescriptions, and they become addicted. And so then they will obtain these drugs initially illegally, but eventually they will get multiple prescriptions from other doctors, or they'll start buying the drugs on the street. Once the addiction's got to the point that it's costing them $200 or $300 a day, they'll oftentimes switch to heroin. 90% of the new heroin addicts started using opiates on prescription drugs before they switched to heroin. So the upsurge we're seeing in heroin overdoses and addiction cases is due to the initial addiction to the prescription drugs.